Okay, if you're a nursing student and you're having troubles with fundamentals of nursing, here are 3 things that you should know that will absolutely help you take your exams. So we know ADPI, we know ABCs, we know Maslow. We know those things are applied to the nursing process. How do you identify them in the questions? For ADPI, usually we're thinking, do we assess, do we take an action, which action do we take, or do we call the provider? For A, do you have enough information? If the question says a patient comes in after 3 days of being home and says something doesn't feel right, does that prompt give you enough information or do you need to assess? The question is, you need to assess. And so you would pick the answer that indicates an assessment action. The next is, which action do you take? You have to think about the actual issue and a potential issue. Perhaps you have a diabetic patient that has a BP of 148/79 or whatever the case may be, who also is saying that they're feeling some numbness on their feet. You have the potential for infection and you have an cardiac output issue. The cardiac output issue takes precedence over a potential issue. Yes, both of them are important. The question is, which is the one you do first? The last tricky thing is, when do you call the provider? The answer is unofficially, usually never. You almost never call the provider, because the only time you call the provider is if ADPI has been done and you're getting an unexpected outcome. Let's say you have in the prompt, a patient comes in, you diagnose them with having an actual condition. Maybe they're, have low breathing. You implement the albuterol, you reassess them and you see that tachycardia is now, their heart rate is now from 101 to 170. Now, some tachycardia is expected. If they had one from 101 to 108, I would be fine. But such a large jump in tachycardia is unexpected. So just because there is a change that doesn't automatically solve the problem doesn't mean that it's not an expected outcome. If you have a change where it is an acute issue, there is an actual versus a potential risk, you have done the implementation, you've reevaluated, and there's an unexpected outcome, then you call the provider. That is how you're going to ace your fundamentals.